what is an EMR, what is an EHR, and what is a PHR.
The EMRs or any technology within healthcare for that matter is always built with doctor outside the loop.
Doctors are not tech savvy. Mm.
Take a physical version of a thing and just replicate it in a digital format.
Mm.
They have ruined that trust of the doctors.
The sharing of the data, the confidentiality of it, the consent aspect of it, what is happening, because it's a very sensitive information. HIPAA makes sure that it keeps everything in under check.
Last time we had a very good conversation on why there is so much of FOMO around or hype around AI as in general or AI as in healthcare as well. So this time actually let's try dwelling into the topic of why actually there is no FOMO around EMR adoption in especially in India for that matter. Doctors are averse to it. There is a lot of confusion on why there is no much digitization on the clinical front. So let's start discussing on that topic, and let's also touch upon where we can go from here, how we can make the situation a little better. So first things first, I think where are we right now in India specifically? In last video we thought it's a failure in India as in overall EMR or EHR adoption. Where do you think we stand as of today?
If I have to speak, being a doctor myself, I would say that in India, we have failed EMR or EHR implementation. I do not have a motivation if I'm starting my practice today that I need to have a digital system, I need to maintain my records electronically, and I don't even know what would happen, what is the benefit, why should I do that. That's the question every doctor starts with. But then if I have to talk from a perspective of our experience working in some successful implementations of EHR and some failed implementation of EHR as well, I would divide it into two segments. One is rural India and the other is urban India. So in urban India, taking most of the clients that we have interacted with or the doctors in our circle and all, they want technology to solve majority of the problems they have
True.
in their practice, and they want tech to be the actual differentiator of their practice, giving them that competitive advantage of why choose this doctor over the next doctor, because here we have many doctors working in urban localities, and patients usually have a choice to go to one doctor to another. Compared to rural India, now let us take from a point of view that who would actually prefer to work in rural settings? Someone with probably a service mindset or some kind of a interest in catering to more and more patients, right? So in that point of view, if we'll see, in fact, I have spoken to a doctor as well in a rural setting in our initial stages of our company. And when I asked him, with an offering of digitization of his electronic records, he said, I'm already overloaded with a lot of patients.
Yeah.
Now, don't add burden to my practice.
True.
I'm comfortable with, how I'm dealing with this. So, in multiple ways, I see a lot of disconnect in terms of what do they have to why do they have to do this, what is it that they get as a benefit from implementation of electronic records. So let's break it down from that angle. So why don't you actually give a differentiation clearly in terms of what is an EMR, what is an EHR, and what is a PHR?
Yeah, I think those words are usually very liberally used interchangeably, and somebody uses EHR in place of EMR. I think it would be better to just put a word on that. So EMR specifically is medical records or clinical records of a patient that have been created by a provider, let it be doctor or a care team, which are restricted to that particular provider or the facility for that matter. But EHR on the other extent, if wherever the patient goes, if they are going to multiple specialties, let it be like they are going to a government facility coming to a private, or within private they are going to multiple facilities, if their clinical record or medical record is connected and a single across all of this, that's an EHR, electronic health record, and these are EHR platforms. A single app cannot usually cater to that. It's a platform ecosystem. PHR on the other end is, as the name suggests, it's the patient side, patient health record. So, or personal health record, some again use that interchangeably. So, it's what the patient maintains. So, not in all cases, it might not be provider driven. Some of the PHR implementations where the patient enters data, they record their vitals, they upload their prescriptions. That's PHR. But one thing I think we should definitely talk about is how EMRs are, they have become that pseudonym or a replacement of practice management.
Yeah, that's
Every EMR player sells, not, they tag it as EMR, India's number one EMR, or biggest, most doctors use our EMR and so on. But more or less, I think a lot of them are practice management systems and not EMR. And so that is one thing that I have observed. So in your experience, when you see this differentiation, practice management versus EMRs, do you think that whole adoption that they talk about, that 35% adoption in clinics, or some statistics is 60 to 70% of EMR adoption in hospitals, do you think it pertains to actual EMR, or is it just the practice management that they're talking about?
Mostly the practice management, or to a greater extent what we have seen in our experience, it is the digitization of all the operational systems.
Correct.
Because in a hospital there are many departments that function together to make sure that the conversation between the doctor and patient ends up in a fruitful manner, right? The service is provided. So all these other entities are digitized, but actually what happens between the doctor and the patient is missed out in the whole equation. So that's the biggest flaw. That's why I call it as a failed implementation.
Makes sense. Yeah.
So let's talk about why should electronic medical records be maintained? Why should the digitization happen, and how we can actually show the doctors or probably our audience the incentive towards digitization of their actual clinical practice.
Perfect. I think one of the aspects before we go into why EMRs are necessary, which is also a very crucial question that needs to be answered, we need to understand the difference between digitization and clinical digitization, like you rightly quoted. I think digitization, a lot of people, even very big hospitals, they implement the entire billing, appointment management, reminders to the patient and all that, but the doctor still writes a paper prescription. You go and sit with them, they will still give a paper prescription, which is actually scanned by a doctor assistant and uploaded onto the EMR, which is not equivalent of actual clinical digitization, right? So that needs to be understood.
If I can just add a point on that, the successful implementations that have happened, also the so-called hospitals who might claim, it is because they've added a manpower like a physician assistant.
Correct.
Who can actually do the digitization aspect of it, which is not an actual consultant who is dealing with the patient.
Correct.
So that's to
yeah, absolutely. And to the question of why EMRs are actually essential, that's a very important question. I think every doctor should ask, because what I have seen time and again is the EMRs or any technology within healthcare for that matter is always built with doctor outside the loop.
Absolutely.
It's always like, this is something that we have done, it will be beneficial for you if you use it. But how beneficial? In what way? Is it actually beneficial? So there was a survey that was done, I think in the first 6 months to 1 year of any EMR implementation in a hospital, the productivity actually comes down by 40 to 50%. There are multiple reasons for that, but why EMRs are essential and how it has to be implemented has a very key lesson in that whole thing. So first things first, I think from the essential point of view, they have been just created as a digitization tool. They are sold as, you write on a paper, rather you write on, you type the prescription. Rather, EMRs are actually the whole portal to unlock everything that has to come after that. Nobody tries to open that channels or tries to talk about it. Simple example is we keep talking so much about personalization of care. For that example, you'll not be able to do any personalization of care if you don't have the basic data of what is the patient allergic to.
Correct.
And in the same way, if we have to do research, if we have to progress forward in how the algorithms are changing, if you have to make more accurate diagnosis, reduce medical errors, there are so many problems that can actually be solved. Doctors efficiency, doctors output, in what the amount of time it takes for them to successfully treat a patient, all of this can be addressed through a right EMR implementation. But sadly, I think without taking the names of certain players, a lot of these EMR players in India, what they do is they just give a it's something called neomorphism. Take a physical version of a thing and just replicate it in a digital format. So they take your prescription, they ask the doctor for how is your case sheet, they replicate that in the application and just give it. If doctors enter something wrong, if there is some other decision support that needs to happen, nothing of that sort happens. Ultimately, it never connects to the doctor. They don't see the difference. If I'm writing on paper or I'm typing it, they don't see any added benefit out of it.
And that is when probably the doctors would feel that I'm more comfortable with writing
Writing,
on a paper.
and that will add to their time. Everybody is not a lot of tech savvy people also don't like typing.
Right.
So expecting doctors to actually type when the patient is sitting, which is a little out of their comfort zone, is not a good enough proposition when there is no visible benefit.
But I would also bring in a point that unfortunately this failed implementation is told to be the reason is told to be because doctors are not tech savvy. Doctors are digitally illiterate. There are multiple such acquisitions that I've heard, and I feel bad for it because it's not right. Doctors are actually they have suffered with using bad kind of systems.
Correct.
We are direct witness of that. It is not directly flowing into their workflow. They have to spend more time with the computer rather than talking to the patient.
Correct.
Or let's say that they are ready to type everything as well while talking to the patient. I'm typing and suddenly that got stuck. Now what do I do? Shall I stop my conversation with the patient? No, right? So there are a lot of such challenges as well, and especially in rural India there is also a challenge of power
Bandwidth.
cuts.
Yeah.
you know
Bandwidth and power cuts. True.
Bandwidth, yes. So those are also the challenges, but mostly it is attributed to doctors not being tech savvy.
Yeah, yeah. So I think a lot of the people that I have conversation to, even the investors that we pitch to, a lot of them give this example of no, doctors won't use tech. Doctors never encourage tech. But that's I wish there is a better way, and I wish there is a bigger platform to just go out and scream to everyone that no, actually doctors are not averse to technology. They are as much as enthusiastic and as much as welcoming towards technology as like any other person. Unfortunately, lot of the players, they have ruined that trust of the doctors. Around I think 2015 2016 times, doctors were really enthusiastic to adopt tech, adopt EMRs and digitize their practice, but they were literally taken for a ride in terms of selling the data to pharmaceutical companies, or trying to steal the patient away from them, trying to sell allied services like lab and pharmaceutical services from the tech side and so on. So that created that whole data gap. I think it is really, really important if you can cover the whole aspect of when a patient data is captured in an application by the doctor, who is the owner of that data? Like, who owns that data? Who can do what?
Mm.
It's very grayed out area right there, and if you can explain it in a simple manner, it'll be a very good.
And a very sensitive aspect
Exactly.
as well. One of the key reasons why doctors are a bit skeptical, because they're unaware of the actual regulations, what they talk about. I think couple of years back we did not have an answer for that, at least in India, but now we have DPDP, Digital Personal Data Protection Law. So this is a learning that we have taken from the European countries, and then we have come up with our set of own guidelines for the data protection. So there are three entities in this, in as per the digital protection data protect sorry digital personal data protection law. Three entities.
Got it. Yeah.
One is the owner of the data, which is patient. The second is data fiduciaries, who are just the controllers of the data. So it means that the providers who capture the data, the facility, they are the actual persons who control the data. They are called data fiduciaries, they are given a term. The third is data processors, and that's the tech players.
Okay.
The processors who manage the data between different entities. The platform providers are the third entity. So the ownership is lying with the patients only altogether, and the laws are enforcing this in a very strict manner now. At one point of time probably it was not there, but even this fact, the doctors are ignorant of this because of the new guidelines. There is no awareness creation on that. More importantly, there are some kind of a legacy tech players who give a different understanding, an alternate reality to these. And doctors don't even know that the data of the patient, for which they are the controllers, they are actually not the controllers. The tech is the controller of that, and they behave as if they own the data. And then that's where the point that you mentioned comes into the picture, of they selling the data to
Yeah.
pharmaceutical companies and everything. So if doctors actually have this awareness of who is the owner, who should navigate that, who should control it, tomorrow who will be questioned on it? Doctor will be questioned on it.
So
The
just to
facility.
sorry, just to clarify, you're saying in this whole scenario, doctor is the data fiduciary,
Yes.
patient is the owner,
Yes.
application providers are just data processors who
Processors.
don't have ownership, who don't have any right to take it outside or
They
do
don't.
anything with that.
They just
Okay.
have to create a facilitation of this whole equation to the facility to whom they are selling their tech. Or
Okay.
if it is to a patient, if they are selling the tech, they have to facilitate this whole
Got it.
exchange of data between different entities. That's the sole responsibility of the tech in this whole equation. So doctors need to realize that tomorrow, as a facility, as a provider, they are bound to be face the questions, if it is coming from whether the government, whether the law, on the ownership of the data, on what is happening with the actual data, because they are the controllers.
Correct.
So tomorrow if they say that, oh, we were not aware of it, our tech player is taking the responsibility of it, we didn't know that they shared the data to someone else, doctors will be questioned. So
Got it.
understanding this is important, and also making a mention of it in the agreements that they have with the tech providers and all, it is also important. Because if there is still the owner of the data, which is a patient, he has all rights to question who is sharing the data to whom, and they should give a consent to the sharing of the data as well. But are we following it? Now probably not to a greater extent. We have not even achieved around 30 to 40% of
Got it.
control on this aspect. But it is going to become more and more stringent and black and white. There is no gray area that's going to remain in the future, probably similar to what the European countries have
Yeah,
achieved.
I think one other place where we can give some throw some light on for the doctor's sake is even from our point of view, when we go to our clients saying that we will deploy EMR or we will install EMR for you and so on,
Hmm.
there are multiple things, right? I think they will ask, like, is it, where is the data, is it on prem, on cloud, can
Hmm.
anyone else see my data, or what if you are training AI with my data without my
Mm.
consent and so on. So if a doctor is going for a new EMR,
Mm.
what are the things that they are supposed to ask, and what clarity should they have? Maybe what clarity should they have, I'll be able to touch upon that.
Mm.
But what are the things that they need to ask? Maybe if you can cover that, that will be really good.
So I'll first start with what they need not ask, which currently is being asked.
Got it.
One is doctors ask a lot of questions nowadays because of the information accessibility, that whether your system is HIPAA compliant or not, whether
Got
your
it.
system is GDPR compliant or not. That's a question that's coming in, right? But let us just give a breakdown of what those are as well.
Okay.
So I'll cover that aspect first, and then we'll talk about
Sure.
what
Sure.
needs to be
Yeah.
covered. So first of all, what is HIPAA and what is GDPR? HIPAA is a healthcare specific privacy law in the US, right? In that particular area, the privacy of the patients is maintained because of those regulations that the HIPAA provides. What the sharing of the data, the confidentiality of it, the consent aspect of it, what is happening, because it's a very sensitive information. HIPAA makes sure that it keeps everything in under check in the United States of America. It is only necessary in that particular geographical location. It is not a necessity in India.
Correct.
Probably the learnings are and the framework that the HIPAA provides are definitely useful here.
Yeah.
But the framework actually enabled us to form our own law, which is
The
the
DPDP.
DPDP law,
Got it.
and then we have the IT Act as well, which is defining certain uh, aspects like how long the data has to be stored and everything,
Makes sense.
right? So that is about HIPAA. Now coming to GDPR, it's in the European Union. It actually does not only cover the health. It, in general, the data storage and protection is what GDPR covers.
So I think it's more like DPDP, right? Because DPDP is also not healthcare specific.
Hmm.
It's personal information.
Yes.
Even my Aadhaar card or
Yes,
is covered in,
absolutely. And
yeah,
DPDP is actually taken as a learning from GDPR
GDPR.
only. It's a
Okay.
derivative of that.
Understood.
So that's what GDPR is all about, and it is limited to European nations. It is not applicable to everywhere. So again, that framework is useful for us. But today, like when we have our conversations with with the doctors or facilities also, we keep getting this question,
Correct.
right? Whether it's HIPAA compliant, GDPR compliant, it's not necessary. So
Yeah.
it is not a question that needs to be asked. Now, on the aspect of what are the questions that they should be asking, let us actually touch base on on cloud and on prem deployment.
Okay. So I think uh, there the whole landscape is changing.
Mm.
Firstly, if you talk about individual doctors or clinics, it's a no-brainer. On-prem is not economically viable for them,
Mm.
for the amount of patients they would be seeing, and for the what does it cost to, like, maintain your own servers on-prem. It's not at all a cost to benefit, high good ratio cost to benefit. It's a no-brainer. They should go for cloud.
You're talking about individual
Individual
clinics.
doctors and even poly or multi-specialty clinics for that
Mm.
matter. For hospitals, I think again there is a twofold perspective to it. The amount of stakeholders that are involved in maintaining that patient data is very high when it comes to hospitals. There is
Mm.
doctors, labs, radiology, pharmacy, and so on. And the amount of places where the data is touched upon is very, very, very high.
Mm.
So there, if they have that economical situation, they can go for on-prem for a more suitable deployment. But again, that will come with its own bells and whistles in terms of who is maintaining, how are you taking the backup, what if a disaster happens, how do you recover the lost data and all that.
Mm.
So those are some things that they should definitely keep in mind.
So probably also, you need to have an in-house expertise of an IT
Exactly,
professional as
exactly.
well.
Yeah, yeah. Without that, I don't think it is
Mm.
possible at all. Uh, And the third aspect, which is changing right now,
Mm.
is should you host AI models on prem or no?
Mm.
And for 99% of the hospitals out there, I don't think it's a, again, from cost to benefit point of view, it's a thing that they should look for, because GPU servers are pretty costly, and
Mm.
for the amount of AI usage that they will do, it will become a very huge bargain. Maybe they can analyze and learn from that, but it will become a huge bargain on what is the cost that is involved and what is the benefit that they are getting.
Mm.
So still, I think one thing that should be kept in mind is, where is the data resting?
Mm.
When you, a lot of people actually ask, this is one of the right questions. If AI is involved, how is the data whole flow happening?
Mm.
Is it like the analysis is happening on cloud? When it is happening on cloud, does it also be need to be stored on cloud? For example, we have taken a lot of care in terms of doing in transit analytics,
Mm.
meaning all of the AI inferences and the decision support happens in cloud, but we don't actually maintain anything on our cloud.
Mm.
It is the same FHIR server, that data server of the patients, that the
Mm.
hospital maintains. We just do the analytics and push back the inferences.
Mm.
So that is a very clever way to do it, where the data custodian is still the hospitals.
Mm.
The data lies in that servers, physical servers, but the AI processing is happening cloud, which is very cost effective.
Mm.
So I think that's how you can look at it.
Right. So, in this point, who will, how is the what the regulation dictates that it needs to be maintained for 7 years or so? How is that going to be beneficial? Whether in comparison of on-prem and on cloud, is there a differentiation? Is there something to learn on that aspect as well?
So I think for as per Indian regulations, 7 years is the time where you have to maintain medical records.
Mm.
I don't think it specifies digital or physical. Even physical, the whole MRD department exists because it has to be retained for 7 long years. In that point of view also, because the amount of data as it grows, maintaining it physically, cost again exponentially grows.
Mm.
But for cloud, there are clever ways in which you can manage it in a cold storage, manage it in a way where it is accessible
Mm.
whenever you need it, but is not always live on the internet in a way where everybody is able to access it if they hack into your system or something. There are multiple different clever ways to do that.
Mm.
Put it in a cold storage, put it in a transient mode where only you can wake the system up and access data if it is required. So if the longevity of the data comes into picture, I
Mm.
think it is definitely better to go for a cloud based system than an on-prem, because there are automated backups, there is disaster recovery that you can easily configure from one cloud to the other cloud, and so on.
Mm. Mm. Right.
Yeah, so now, circling back to what we were discussing, this is definitely one thing doctors should understand whenever they are taking an EMR,
Yeah.
and maybe consider on-prem and all that based on this. But
Mm.
what are the other questions? Like, what are the other questions that they should definitely ask?
In continuation to that, I think the aspect of how secure this platform is to store the data, to make sure that it is not hacked, like what happened with AIMS and some big private entities
Correct.
also. How secure is the platform is something that doctors have to understand, because at the end of the day, they are the ones who is determining where the data of the patient is going and sitting in, so they'll be questioned on that. Apart from that, I would say that doctors need to also understand how this system, this EHR system, is actually going to store the clinical information. How is it going to sit in the workflow during their conversation? Do they have the luxury of still continuing with a pen and a paper? And is there any engagement between the patient that's taken care of by this system?
Right.
Is there any offload of their responsibilities that is happening, or do they have to spend some more time adding a few more seconds of their time in their practice, is something that they'll have to very crucially understand. Because at the end of the day, like we discussed the rural scenario, there is a huge patient load. In that time, it is always a trade-off for a doctor to decide whether to take this tech or not. That in that few seconds added, they might be able to see more patients.
Yeah, yeah.
Right? That's the kind of a vision that the doctor would have. So I think those are the questions that they will have to ask, and the tech providers have to answer.
I think, yeah, I was actually asking from more from a data point of view, but
Mm.
this makes more sense from even the question, the last point that you have mentioned. They'll need to understand what is in it for them.
Mm.
That also needs to be clarified by the tech provider. That's what
Yes,
you're
yes, yes,
basically
yes.
saying. Other than the data security, where is it being stored? How is it being accessed? Who all have access to it?
Mm.
I think one of the crucial things that they need to understand from tech players is how is it going to benefit
Mm.
those
Correct.
particular things. So when we're talking about on the landscape of data and DPDP Act and so on, what do you think is the government's role or regulation? I think point number one. And point number two, if we have to increase the EMR adoption in some way, what is the right way to do it? Is it fear driven regulation route or incentive driven personal adoption kind of route?
Yeah, so on this second question, probably this would be my opinion of how I've seen things, and I would also want you to share your opinion on this as well. So, the first point, what is the stance of the government? So, government has established guidelines on the EHR standards. They have done their job to certain extent.
Yeah.
From there, how things have progressed is on the implementation, and making sure that the implementation is happening in a very seamless way. To an extent, in the government facilities there is adoption of EHR. I think we have seen it in AP government and few other state governments ourselves, in terms of how implementation has been there. And it actually took me by surprise to see the kind of interest of state governments in
Yeah, yeah,
adopting to that, right?
correct.
So in that way there are regulations there, but the adoption of that is completely voluntary now. So nobody is going to question your practice whether
If you
you do
don't,
not,
yeah,
whether you do not have that. Are patients questioning it? Today the answer is still no, right? If you take western countries for that matter, patients would question, because they have a right to question. They have they demand their services in that way. But here patients um, do not actually use their right in the right way. I
got it.
would say. So government has not regulated it in a very stronger way. Again, coming to the second question from there, my personal take is that there needs to be stricter regulation which is driving the adoption. um, to a certain extent, it needs to be a top down approach, because otherwise there could be vested interests of all the other players in the ecosystem who would be steering the adoption in different directions, right?
Correct.
So there could be vested interests of facilities, there could be vested interests of tech players that are coming into the picture, which will actually make it more chaotic, I would say, because almost since 2 decades we have seen that the implementation, there is a ups and down kind of a situation. And now we have a hype around AI also, which we have discussed the last time.
Correct.
How can AI be actually implemented in the healthcare if there is no actual digitization of clinical records only? So I would say that in the current situation that India is in, we need a top down approach. But
Okay.
how successful will we be? I don't know. The time has to decide, I would say. And we've got doctors interested, and in this direction as well, that I keep seeing. So what is your opinion?
So I think I come from complete opposite direction in this point of view, because regulations will take the horse till the river.
Hmm.
It will not make them drink the water. That's what I always believe, not just from this perspective, but even from a general point of view.
Hmm.
And when I say it has to come from bottom up or it has to come from the doctors, I think hospitals are the best example, right? Like, if you just make it mandatory for them, they will use it. They'll use it for namesake. They will enter the diagnosis, they'll enter the medicines,
Mm.
and they will say, this is digitization, this is what I can do with my limited time. Only when that incentive from their personal belief, they actually trust and know for a matter of fact that if I enter the crucial clinical information of this patient, it will be beneficial in this manner for me, maybe from a longitudinal care point of view, may it be from research and academical interest point of view, may it be how it streamlines the entire operations for themselves, how it makes a lot of the other aspects easy and eventually saves time for them. Focusing on creating that incentive for doctors is very important. I mean, lot of people I see, they try to focus on the administrators, they try to focus on the patients, but I am a strong and big believer of, if something has to change in the entire healthcare ecosystem, it's the doctors. They can make the system, they have the power to break the system. And all the tech providers, including us, I think we should strive to create that enthusiasm from their side and address it.
Mm.
Do it in a way where they really find the benefit and they are actually moved by, okay, this is how exactly you're supposed to do clinical practices, what we'll need to reach. And whatever I'm saying, this is more fantasizing of the whole,
Idealistic.
yeah, idealistic way of doing it. But if I have to bet on regulation or this thing, I would still take a more weightage towards incentivizing it and making it interesting
But
for the doctors.
so, is it not just for the sake of the debate? Is it not adding more responsibility to the doctor, which is already there? I mean, see, doctors are questioned when something goes wrong in a hospital. Doctors are always, the first ones to be pointed out and called out in that way. Be it patient did not get the right treatment, or patient did not get the right treatment on the VIP kind of a scenario also, doctors are questioned,
Correct.
isn't it? So when we are talking about actual digitization of patient health related information also, if we are making the doctors responsible again, how is it going to work out
Yeah,
in
so
countries like India?
the responsibility usually comes from regulation.
Hmm.
I'm saying it should be normalized,
Ah.
not regulated. So normalization is usually self-driven. I should feel this is how exactly it is supposed to be done.
Mm.
So even from that questioning point of view, doctors, I think, will definitely have a bigger hand to answer questions. Let it be from medical legal point of view, or let it be from other scrutiny point of view. They will definitely have a bigger hand if they have evidence on their side rather
Mm.
than the other party side.
Mm.
So even from that point of view, it is still something that doctors can drive. It is still something that I'm not asking that they should own it up, but once they see the benefit, I'm saying 100% we will see a difference from the doctor's movement point of view only. They will drive it from their self driven point of view rather than somebody else telling I should take responsibility point of view.
So you're telling that in a hospital kind of a environment, it cannot be a top management driving the adoption of this, but rather doctor making a decision on this. I
Correct.
think that's a very very crucial understanding, I would say, because again, in this whole equation, if the hospital or the facility is deciding on certain aspects, doctor might feel that they enter something in the digital space and it will be stored forever. Their mistakes also can be stored forever, and they can be, taken advantage of in that way as well.
Yeah, so let me put it this way. Uh, if you are doing a UPI transaction or you're sending money to someone, you always double check the name or double check the account number and so on, just to ensure that it's going to the right person and you don't end up losing money.
Hmm.
There, that simple fear is actually making you better. Okay, knowingly or unknowingly, that
Hmm.
becomes a habit over a point of time. EMR should not be any different, is what I'm trying to say.
Hmm.
When you have that little bit of uh, obligation to recheck things just because it will be digitized, that's a good thing.
Hmm.
It's not like I'm forcing them to if you are scared that my mistakes will come out,
Mm.
that's when you stop making mistakes. It's I'm saying it's the other way around.
Mm.
That should be one of the driving factors, even for their self growth and their better practice point of view. That should be a
Mm.
case.
I think that's where our advocacy of evidence based medicine also comes into the
Exactly.
picture,
Yeah,
right? So,
yeah,
how the millions of decisions that doctors are making, at every decision point, there is a validation of the evidence coming into the
absolutely.
picture, and that's where the actual efficiency of the whole healthcare equation is coming in.
Exactly. And I think that is one more thing we should definitely cover in the coming conversations is
Mm.
doctors. Usually people look at doctors like they are supposed to be superhuman,
Mm.
not make mistakes at all. We should understand that they are humans too, human beings too.
Mm.
For the cognitive load that they go through from seeing so many patients, trying to make so many calculations,
Absolutely.
they are bound to make mistakes. You cannot say no, that's not right. Okay, because with the amount of work they do, it is possible.
Mm.
We should find ways to assist them in a way where it is not being done.
Mm.
And digitizing is one of the actual easiest ways to do that.
So the system entirely has to come together to assess the doctor in making sure that the decisions are ultimately
Exactly.
happening in the right way.
Exactly. Yeah.
But it's not that the system is just standing as a third person here and then questioning doctor on everything, right?
Absolutely. Exactly.
Hmm.
It has to be assistive,
Correct.
not condescending.
Yeah. So I think from here, I would like us to discuss on the aspect of when we actually thought of starting Oxidius. We we have received a lot of feedback from multiple different advisors and everyone. Why are you starting another EMR system, right? And they have actually shared their failed implementation, their failure
True.
stories also, and then
True. True.
they discouraged us to work on such kind of a system. But then now we have Clinestra and we want to position it in some place. So let's talk about that a little.
Yeah. So I think there is an emotional answer to it and there is analytical answer. Emotionally, I can always say nobody was else was able to do it. I will do it and show kind of a thing. But
Mm.
uh, with that piece aside, if we go to the more logical answer or the analytical point of view, there is a certain pattern in which you see that why EMRs have failed
Mm.
to maybe go the doctor. One of the thing is they were never able to show the incentive.
Mm.
So that's a problem. That's a problem where it felt it can be solved
Mm.
by simple things. First of all, keeping the doctors in loop. That's the reason I think when we found our research partners across specialties, uh, 20 people is not a less number. But why we wanted that more number is we wanted that clarity key. This is beneficial for doctors or no?
Correct.
I don't think we developed anything which doctor said this is not beneficial to us.
Mm.
So everything that we put into Clinestra was from that single point of view. Okay, this is benefit for me. If some doctor said that or some our research partner said that, we went ahead and built it. That is point number one, the benefit and the incentive point of view. The second thing, I think one of the ways where EMRs failed is they have been looked at as a one shoe fits all sizes kind of an approach. You give an EMR, you expect the doctors to use it in for any specialty, any case.
Mm.
So I think one of the challenges that we addressed, and one of the challenges I think we took a lot of time for that matter to address and come to a state where now we feel
So
it
many
is, yeah,
iterations.
so many iterations, and is that whole aspect of modularity.
Mm.
Now I am at least very confident and proud to say that Clinestra is in a place where we can reshape the entire thing with a small command and give it a separate version of it to psychiatrist,
Mm.
give a separate version of it to a gynecologist, give a separate version of it to a dietitian or a nutritionist for that matter.
Mm.
So to achieve that kind of a thing, you need focus.
Mm.
We had to say a lot of no's. we had to say no, we will not
Which
build.
was very difficult.
Yeah, we had to say we will not build a billing system, we had to say we will never build a HIS, we had to say we will never build an inventory system, pharmacy, lab, for so much, just to solve one problem, which is how do you enter clinical data very easily with more insights, more benefits that the doctor can reap, and which can actually shape shift. If I have to use a layman word, how can a system shape shift for every doctor? That's what we try to crack, and I think we are close to a very good breakthrough on that. That we will definitely let all the doctors experience across the world very soon. So there were doubts for us also. Definitely, maybe
Yes.
EMR was not the right thing to do, but now that I see it, I think we are in the right space, and this is how it's supposed to
I
happen.
think that's the whole reason why we always find it difficult to articulate it in words and describe what Clinestra is
Yeah,
ultimately.
correct,
Right? Is it a PHR? Is it an EMR? Is it a practice management system?
correct,
So that answering those questions, I think, have actually narrowed down as our understanding also, and then come arrive at a
correct.
ultimate product
Yeah,
that
yeah.
we can give. Yes.
So I think that was a interesting conversation, like
Yeah.
the last one.
Did we miss anything though important on the EMR EHR aspects?
Have nothing much, just that the future definitely looks better with AI scribe. That was one of the things we definitely missed.
Mm.
Everywhere you see now, EMR is
Yeah.
getting replaced by AI scribes and all,
Mm.
but
Mm.
I think it's again one of
Something to
the,
be experienced and
yeah, one of the
time tested.
waves of hype. There is how it again fits into workflow
Mm.
is what matters.
Correct.
Let it be EMR or let it be any tool for that matter.
Mm.
Is it creating one more step in the process flow of how a
Exactly.
doctor
Adding a few
treats?
more
Yeah.
seconds or not.
Or is it decreasing or getting into that flow and trying to decongest it?
What
That's
we
what
call
matters a
as
lot.
improving the impact per minute.
Yeah, impact per minute. I think
Mm.
that's all matters. AI scribes are trying to nail that, and that's good for it. But
Mm.
will AI scribes actually solve EMR for that matter? I don't think it is the answer. Uh,
In Indian scenario, we don't know it yet.
yeah, even if the models have become so good that it can understand Indian dialects, different
Mm.
vernacularity of Indian languages, I think there is more to EMRs than scribes,
Mm.
because that is solving one piece of the engine, which is the
Correct.
ingestion of data.
Mm.
But how is it stored? How is it processed? How are analytics getting generated from that? That's where the entire essence of EMR lies.
Personalization comes into
Exactly.
picture.
We see a lot of AI scribes that do dictation, give easy documentation. They save time. They're
Mm.
solving a critical problem, no doubt.
Yes.
But if I have to ask if AI scribes are equivalent to EMRs,
No.
definitely not. They maybe are solving 20% of that problem, and
Mm.
80% is yet to be solved.
Yeah. Right. Probably we'll cover more of that in our
Yeah,
next
we
conversations.
can definitely do that, and maybe
Yeah.
we should call someone else next time rather than
Just
showing
having
our,
a conversation between us.
yeah, only as both. We should try to get in one of our friends or anyone for
Yeah, let's
these
do
kind of
that
things.
and get an actual person who has experienced these kind of systems
Exactly,
and get their
exactly.
perspective as well.
Less gyan, more practicality. We can do
Yeah,
that
right. Good conversation.
always.